Welcome back guys. Now in this video let's discuss about the constrictive pericarditis. So what exactly is this constrictive pericarditis? And the name itself is there is some constriction. The heart is getting constricted. Okay, who is constricting this heart? It's the pericardium. So what happens in this condition is initially there will be pericarditis and this pericarditis will heal. Okay, there is pericarditis because of some reason. Okay, because of some radiation, because of some infection, okay, because of some uremia, there is pericarditis and that pericardium is going to heal with the process of scarring or fibrosis and with calcification. Now this calcified pericardium, the calcified pericardium around the heart, it is actually constricting the heart, it's actually compressing the heart, or rather it's not allowing the heart to properly relax. Okay, so that's what happens in the constrictive pericarditis. Okay, so why there is this constrictive pericarditis? Or first let me tell you what exactly is that. There is fibrosis, and there is the scar formation, right? Because of the healing, fibrosis or scar formation, or the calcification of pericardium. Okay, so this constrictive pericarditis, it is seen in which cases? See, the etiology, okay, etiology, it's seen after heart surgeries. It's seen after the heart surgeries. So during heart surgery there is some damage to the pericardium and the pericardium is going to heal with the fibrosis or scar formation. So heart surgeries can lead to constrictive pericarditis or post radiation. The patient is going through a radiation exposure to the chest. During radiation exposure, not only the cancerous cells are going to die, this radiation can also cause damage to the pericardium and the pericardium is going to heal with the fibrosis or the scar formation. That can lead to the constrictive pericarditis. Okay, and third example is a TB. Okay, so TB initially causes the pericarditis, the caseous pericarditis variety. So especially in the developing countries. So pericarditis later will heal with the calcification and that will lead to the constrictive pericarditis or viral pericarditis. Okay, viral pericarditis can happen. So these are certain causes which can lead to constrictive pericarditis. Okay, these are also the MCQs which were asked. So after surgeries, after radiation exposure, or after TB, or after viral pericarditis. Okay, now here you can very well see that the heart is surrounded. Okay, here the heart is surrounded with the pericardium and the pericardium is now whitish in color. Why it is whitish in color? Because of the calcium deposition. Okay, because of the calcium deposition. So that's the constrictive pericarditis. It's actually squeezing the heart. Okay, constricting the heart. Now, what are the clinical features? If a patient is having this constrictive pericarditis, what are the clinical features? See, the clinical features, this constrictive pericarditis and restrictive cardiomyopathy are going to be especially seen on the right side of the heart. So this constrictive pericarditis is also showing the right heart failure, symptoms. Okay, symptoms of right heart failure. Now what are the symptoms of the right heart failure? The symptoms of the right heart failure include, okay, the jugular venous pressures, JVP is going to be elevated, okay, and the lower extremity edema, okay, lower extremity edema can be seen. In the liver there is congestion, the congested liver, if you look, it will look like a nutmeg, so there is nutmeg liver. So the point which I want to put into your mind is one thing, the restrictive cardiomyopathy and constrictive pericarditis which I am discussing right now. This constrictive pericarditis is going to affect especially the mainly the right side of the heart, so the right heart failure symptoms are going to be prominent. Okay, yeah, dyspnea can also be seen, but these are more prominent. Okay, now after this, what else you should know regarding the constrictive pericarditis is Now the heart is getting compressed from all the sides, right? The entire heart now it's surrounded by a calcified pericardium. The pericardium is calcified. Now this pericardium is restricting the relaxation of the heart. So what happens from outside? There is some constriction. So during diastole, not during contraction, during when the heart is relaxed. When the heart is relaxed, now this heart is surrounded by the calcified pericardium. So it exerts pressure. It's now compressing the heart. So if you look the pressures inside the heart, what will be? The pressures inside the heart are going to be elevated, no doubt. The diastolic pressures are going to be more when compared to normal. But the pressures are going to be equal. From outside, this calcified pericardium is compressing the heart equally from all the sides. So there will be equalization of pressures. This is something important, especially for your exams. So what can be seen? There will be equalization of pressures in heart chambers. Okay, equalization of the heart chambers, and that too right atrial pressure, right ventricular pressure. Okay, all these pressures are going to be elevated because compression from outside. Okay, not only right side, left side also, all the pressures are going to be elevated. Now, remember when I am discussing about a topic called as cardiac tamponade. Okay, in cardiac tamponade, the patient is going to have something called as pulsus paradoxus. Pulsus paradoxus is going to be seen in cardiac tamponade. Such kind of pulsus paradoxus, usually students will confuse pulsus paradoxus, it is seen in constrictive pericarditis. No, pulsus paradoxus, that is exaggerated fall in the blood pressure, more than 10 mmHg, that is seen in the cardiac tamponade. But here in constrictive pericarditis, there is no such thing as pulsus paradoxus. But as an auscultatory finding, what else you can see is pericardial knock. Okay, so pericardial knock is going to be seen. That's a diastolic murmur. Okay, so a diastolic murmur called as pericardial knock can be seen. Now, what else you have to know is Kussmaul sign. Kussmaul sign, it is positive in constrictive pericarditis. Okay, in constrictive pericarditis. What exactly is this Kussmaul sign, sir? This is very important. Okay, without knowing this, you should never go to the exam. Kussmaul sign is positive in constrictive pericarditis. What is Kussmaul sign? Normally, when you inspire, okay, let me tell you. Okay, so whenever you are doing inspiration, what happens? The negative intrathoracic pressure, whatever is generated, it will suck the blood towards the heart. Okay, so during inspiration, see, whenever I am doing inspiration, the thoracic cavity expands. There will be negative intrathoracic pressure which will suck the blood towards the heart from superior vena cava as well as inferior vena cava. It sucks the blood. So even from the superior vena cava and internal jugular veins, the blood is going to be sucked into the right atrium. Okay. So what happened to the jugular venous pressure? So during inspiration, the pressure will go down because all the venous blood is going to drain into the right atrium. So the pressure in the internal jugular veins will come down. So normally, let me write what is normal first. So normally during inspiration, the jugular venous pressure decreases. Normally it decreases if during inspiration. During inspiration, if the JVP, if it is not decreasing, or rather increasing. Okay. So if it is not decreasing or if it increases, then it is called as Kussmaul sign. Okay. Okay. So it's called as the Kussmaul sign. So what is Kussmaul sign? Kussmaul sign is increasing the jugular venous pressures. Normally jugular venous pressure should fall, but now in constrictive pericarditis, it's not falling. If you ask me why it is not falling, See, try to understand, it's very logical. The heart is surrounded, the ventricles, the right ventricle for example, say. The right ventricle, now it is surrounded by the calcified pericardium. So do you think it will relax properly? No, it will not relax. It will not accept the venous return. Okay, even the right atria will not accept the venous return. So when the venous return is not getting accepted, okay, now normally the heart should relax and it should accept the venous return during inspiration. Now the heart is surrounded by a calcified pericardium. So now it will not relax properly, it will not accept the venous return. Whenever the venous return is not being accepted, so what happened to the pressures? They are still high, they are elevated, right? So in constrictive pericarditis, the patient is going to have Kussmaul sign. Okay, point which I want you to know is this Kussmaul sign it is positive in constrictive pericarditis, restrictive cardiomyopathy. Okay, in restrictive cardiomyopathy also this will be seen, restrictive cardiomyopathy, as well as a right ventricular MI, okay, in right sided MI. So these are the three conditions which I want you to know for your exam. Definitely this question will come in your exam, that the Kussmaul sign is going to be positive in which of the following condition? In constrictive pericarditis, yes, in restrictive cardiomyopathy, and in right sided ventricular myocardial infarction or the right sided heart failure cases. In these conditions, the Kussmaul sign is going to be positive. Okay, done. After this, what else you should know for your exam? Again I am telling you, this Kussmaul sign is not going to be seen in cardiac tamponade. In cardiac tamponade, what you appreciate is the pulsus paradoxus. Pulsus paradoxus is seen in cardiac tamponade. Kussmaul sign is seen in these three conditions, okay, but not in cardiac tamponade. Now, if I am talking about the JVP, jugular venous pressure tracings, okay. Okay, why again? Already P is there, no? JVP tracings, JVP waves. Okay. Normally, what do we have? We have waves something like this: A wave, C wave, X wave, V wave, and Y wave. So these are the waves, right? Okay. A wave due to atrial contraction, C wave during the closure of the tricuspid valve. The C wave will happen, and this is X wave due to atrial relaxation. Okay, atria is getting relaxed, and this wave which I am highlighting right now, okay, this wave is V wave because of the venous filling, and Y wave atrial emptying. V wave is because of the venous filling of the atria, that's atrial filling, and Y wave is because of the atrial emptying. Atria is emptying its blood into the ventricle. Okay, right atria emptying into the right ventricle. All these are the all these are happening on the right side. Okay, so these are the jugular venous pressures. Okay, now my point is, if a patient is having constrictive pericarditis, what are the changes that one can expect is, see, in constrictive pericarditis, the pericardium, it is calcified, okay, it is thick, calcified, it is very much adherent, okay, it is very much adherent to the heart, okay, it's very much adherent to the myocardium, it's sticky, very much adherent to the heart. During diastole, you know what happens? Normally during diastole, pericardium, it will move out. Okay, during diastole, normally pericardium, healthy pericardium, it will move out, it will snap back. But in this condition, in constrictive pericarditis, yes, it is a sticky pericardium which is attached to the myocardium. See, there will be a rapid, okay, there will be a rapid movement, okay, not complete, just for a brief period of time, this pericardium, this thickened pericardium which is attached to the right ventricle, it will move like this. When it is moving like this, automatically the right ventricle, see, the right ventricle, it will also suddenly move like this. Okay, so first pericardium is moving out, even the right ventricle, myocardium, it's also moving out. So what happens? now there is a rapid relaxation, not complete relaxation, remember, not the complete proper relaxation, just for a moment there is rapid relaxation, not complete. So because of this, what happens, whenever the ventricle is relaxed, now it will allow the blood, okay, it will suck the blood from the right atrium. Whenever it is sucking the blood from the right atrium, see the right atrium is now emptying, now right atrium is rapidly emptying the blood down into the ventricle. Again I am telling you, the total emptying will not happen, just for a minute, or I should say just for a brief period of time. Now the calcified pericardium, it will relax. Now that causes the movement of the right ventricle to also just relax like that. So that will suck the blood from the right atrium rapidly. Whenever there is sucking of this blood from the right atrium rapidly, now what happens? Now the Y wave, atrial emptying, this Y wave, it represents what? It represents atrial emptying, no? It represents the atrial emptying. Whenever it's representing the atrial emptying, what happens? Now in this condition, this Y wave is going to be prominent. Okay, the prominent Y wave. Okay, let me show you the dotted line. The Y wave, it's going to be much more prominent. Okay. Okay, now it's something like this. Okay, Y wave is going to be prominent. But what happens? See, just for a brief period of time, now the blood from the right atrium, it falls into the right ventricle very rapidly. But do you think proper relaxation of right ventricle happened? No, there is no proper relaxation of the right ventricle, right? Because it's calcified pericardium, no proper relaxation. So again what happens immediately? The pressure will increase. The pressure will increase. Okay. So the one point which I want you to know for your exam in jugular venous pressure tracings is that there is a prominent Y descent. Okay, so there is a prominent Y descent. See, very, like, see, the slope is very high. Okay, so there is a steep Y descent, a prominent Y descent that's going to be seen in constrictive pericarditis. Okay, just try to recollect. In a patient who is having cardiac tamponade, okay, just I am trying to integrate cardiac tamponade. What are the JVP changes that are going to be seen? The JVP changes are going to be prominent X descent. Prominent X descent is going to be seen, but blunted Y descent. Okay, so prominent X descent and blunted Y descent in C is going to be seen in the cardiac tamponade. In constrictive pericarditis, the patient is going to have a rapid filling of the ventricle just for a brief amount of time. That will cause a prominent Y wave, but again the pressure will go back. Okay. So these are some important points which I want you to know. Actually, these are things which won't come in pathology. I'm just trying to integrate with the medicine things. And one more thing which I want to put into your mind, I'm not going to in detail. If you look at the right atrial pressure tracings, right atrial pressures, you are going to have a sign called as dip and plateau. Okay, dip and plateau, which is also called as square root sign. Square root. This you will study in detail in your medicine, but just remember, when you are checking the right atrial pressures, you are going to have something called as a dip and plateau. Okay, so you are going to see a dip and plateau, or the square root sign is going to be seen. So these are some important points which I want you to know regarding the constrictive pericarditis. Okay, what are the important points which you should know? The patient is going to have mainly the right-sided symptoms. Okay, right-sided heart failure symptoms are going to be prominent. The patient with constrictive pericarditis. Oh, one more point I want you to know. If you take EKG of this patient, EKG, there is a calcified pericardium. No, the pericardium is calcified. Do you think properly it will conduct? Do you think there will be proper conduction of the electrical activity? No. So whenever you do the EKG is going to show the low voltage waves. Okay, EKG will show low voltage. Okay, so low voltage EKG waves are going to be seen, and that's the one important point which I want you to know. So right atrial pressure shows dip and plateau sign or the square root sign. On jugular venous pressure tracings, the prominent Y descent is going to be seen, and the patient is going to have the Kussmaul sign. The Kussmaul sign is nothing but the rise in the jugular venous pressures. Okay, rise in the jugular venous pressures during inspiration. So with this, I have covered all the important points which you need to know for your exam. Hope the video is helpful. Thank you.